So look, thanks everyone for dialing and logging into this ASNEN session. Just for a little bit of info about how to expand the screen, you can see there's an icon in the top right-hand corner that will expand to a complete slide. And if you want to get back to the chat facility so that you can post a question either along the way or at the end of the session, you just hit escape on your keyboard and that'll take you back to that other screen where you can access chat. So please post those questions as they arise via the chat facility, and Alana will answer them either as she goes along or at the end of the session. So welcome to this ASNEN Professional Development webinar. I'm Patrick Root, one of the co-chairs of ASNEN, and I'll be moderating the session. The ASNEN Steering Committee would like to thank Boehringer Ingelheim, the Stroke Society of Australasia, Stroke SA for their generous support for the ASNEN initiatives. Thanks also to the National Stroke Foundation and the Victorian Stroke Clinical Network for helping promote our webinars, as well as to the NSF for making these recorded sessions available on the newly or not so newly launched InformMe. Don't forget to check us out on our website, www.asnen.org, where you'll learn of future education events. Today's webinar, the topic for today is Enableme and InformMe, presented by Alana Stewart, Team Leader, Stroke Connect Victoria, or one thereof. Thanks, Alana. I'll hand it over to you.
Fantastic. Thank you, Patrick. And as he mentioned, I've got Calvin Hill with me as well as some other Stroke Foundation colleagues. So let's get into it. I've got a few videos that I'll be showing throughout the presentation. So again, if you can't view them, please let me know in the chat field and I can give you another option. Okay. So as Pat said, today's presentation, we're going to start with looking at InformMe. So I'll give you an overview of our health professional site. We'll look at the development process behind InformMe, its relationship with the guidelines and the audit. We'll look at InformMe features, including learning and resources, stroke data, quality improvement and collaboration, and then I'll give you a walkthrough of the site and show you a demonstration video. We'll cover things in a similar format for Enableme, again giving a general overview, looking at the site's functions, accessibility features, and then we'll finish with some user stories. Hopefully there's a few of you out there that have visited InformMe and Enableme, so you may already be somewhat familiar, but I'll be adding to your knowledge as we go. So I think we're all here in today's webinar because we want to deliver stronger stroke care. The gap between clinical care that is recommended in best practice guidelines and what actually happens in Australian hospitals is costing lives and money. The stroke community has a number of strategies to help close this gap and improve outcomes for those who suffer stroke. These include the clearly defined, robust national guidelines, a framework for monitoring the provision of the guidelines through data collection, and mechanisms for feedback and targeted support for improving access to quality care. As you can see, these strategies are interdependent. The guidelines don't work without understanding the analysis of how well they're being implemented, followed by strategies to close the gap. Data alone doesn't drive the action, and we need a multifactorial approach to use the data to inform activities focused on improving quality of care. And this is where InformMe comes in. It aims to bring all the resources together with a focus on quality improvement. Okay, so InformMe has been created by the Stroke Foundation to improve stroke care within Australia by providing health professionals with the tools and resources that they need. InformMe was launched in March 2016, and the consultation process that led to the creation of InformMe involved 282 health professional surveys, 22 in-depth surveys, and a workshop here at the Stroke Foundation. The consultation looked at the challenges that health professionals face when accessing information online. Findings showing that often one stroke team member is responsible for seeking out information and sharing it with the team. We found that health professionals are time poor and prefer information to be accessed quickly and in bite-sized chunks, and that there are limited opportunities for professional development. We also looked at your ability to access computers, phone and tablet use, and your awareness and access of our previous site, eStroke. So a summary of that feedback you'll see here on this slide. There was great support for the development of InformMe by health professionals, and there are a number of things that you requested or wanted as part of the site. So learning content room and room for improvement, support for online clinical guidelines and the updated version, visual benchmarking data for the National Stroke Foundation audit, demand for interpreted relevant emerging evidence, and there was a demand for knowledge sharing on clinical change. So the key areas of InformMe can be seen here. I guess from those surveys and workshops, this is what we were able to establish, these 6 key areas, and I'll be running through each of these in more detail now. But you can see there the membership area, clinical guidelines, learning and resources, stroke data, collaboration, and improving care. So we'll go first to the guidelines. Currently on the site you'll find the 2010 clinical guidelines, and you'll also see the guidelines for the assessment and management of absolute cardiovascular disease risk and the childhood stroke guidelines here as well. The 2017 guidelines, which are due for release obviously next year, will be found here as well. And we'll be able to update the guidelines as new research becomes available, which will allow for greater interaction with the guidelines and hopefully encourage health professionals to review how their individual practice and that of their hospitals compares to the evidence base. The InformMe quality improvement tool that I'll show you in a few moments aims to again bridge that gap between the guidelines, the stroke audit data and stroke care. Apologies for the quality of my voice, I've got a cold at the moment, so yes, sorry. The next section there, learning and resources. So InformMe has a range of learning modules, research, blogs, websites and videos. This content is updated as new resources become available. And if there's a particular resource that you're looking for that's not there, or there's something that you use regularly and you think other users would benefit from it, please contact us and let us know. You can also suggest and add tools and templates yourself and follow topics of interest. The follow topic feature allows you to favourite and follow the topics. This then means that any new content related to the topic will be visible in your feed when you next log into the site. So you'll also see any health professional development modules that are partially completed. They will be saved against your profile, and then when you finish those you can print a certificate as evidence of professional development. So the next section of the site is stroke data and improving care. The stroke data page allows you to access your hospital's audit stroke data and create specialised quality improvement plans. You can compare your hospital's audit performance to the national average, as well as to hospitals with a similar number of stroke patients. You can also review how your hospital has progressed over time when compared to audit data from previous years. You'll notice that at this stage there is only the 2015 acute audit data available, and we hope to have the 2015 rehab audit data up here by the end of the year. What we really want to do though is to A, get you to view your data, but then go forth and identify areas for improvement. It's really about taking that bold step of creating a quality improvement plan, which I'm going to talk you through in a minute. The stroke data page allows you to step into this quality improvement process. There's a great step-by-step framework with a number of tutorial videos that talk you through the process, and it allows you to edit your plans over time, to receive reminder updates of how your quality improvement plans are tracking, and share your plans with other InformMe users. Collaboration. The collaboration section is a little short on content at this stage. We hope that as more users join and their confidence in navigating the site improves, that users will ask questions, share frameworks and models of care, share business planning documents, case studies, fact sheets, implementation tools, templates, videos, anything really, anything that they feel other clinicians may benefit from. I would strongly encourage you to get in here and have a look, ask any burning questions that you may have, as well as view questions that are already posted, or at least contribute to the discussion. Collaboration is really working as a team to find a solution to a problem, so we really need a team approach to make this area work. If you haven't been to this section already, pop in and have a look. And now the InformMe user information. So InformMe has a number of ways in which the site can be personalised to you and your needs. Obviously the My Profile section contains things like your name, your occupation, and your affiliated hospital. Then you've got My Feed, which displays the latest content added to topics that you've chosen to follow, as well as featured links and documents for you to use. So if, for example, you follow the topic dysphagia, anytime that new content related to that topic is added to the site, it will get pushed onto your feed. So when you log in, you'll see it there. The My Bookmarks contains any tools and templates or articles that you've bookmarked, allowing you to return to these and read them at a later date. Great if you only have 20 minutes or so and you only get, say, partway through an article, you can bookmark that and then return to it. The My QI Plan section, which I referred to previously, contains QI plans that you've created and allows you to update these and monitor their progress. And the My Learning keeps a record of all the modules that you've either started or completed, and then you can see the date that you've done those and print off any certificates. And like any new online site, InformMe is constantly evolving to meet the needs of its users. The more that health professionals interact with the site, provide feedback and share it with colleagues, the better it will be for all of us. Just one more slide before I show a brief video. I wanted to touch base about the registration and approval process, and particularly the validation to view your site's audit data. So we understand that this validation process has been slow for some sites. I just thought I'd run through the process now to clarify things. So what happens is head to the site, so informme.org.au, and there you can sign up to the site, or if you have previously done that, you can edit your profile, and this is where you add your hospital site. So when you select that site, your site coordinator is notified and asked to validate that you are an employee of that site. Just reading on here. Tony, is that any clearer? I'll keep talking, let me know. Okay, so yes, so you sign up, your site coordinator is asked to validate that you're an employee of that site, And then once you've validated, you'll receive notification that your access has been granted. So the validation process exists because we need to ensure that data is available to staff within that facility. This solution was discussed and teased out extensively during the development. However, we still do realise that not everyone's aware of the process. So we're trying to improve communication to the site coordinators so that there's not that backlog. Your site coordinator, in most cases, is the audit coordinator. So if you require a new coordinator to be added, or if the staff member is no longer in the role, please do let us know so that we can update our records. Okay, I'm going to now show a video, hopefully, that gives just an overview of the site. I'm showing it through YouTube. Hopefully everyone can see what I'm doing. Michelle, that's a really good question. I will pause and ask that one now. I may even hand over to Calvin. Are we able to approve students visiting our site?
The registration process only allows sites to view their data specifically, so students can basically access all of the functionality. Most of the site is completely open, so there's no problem with students accessing. It's only to view the site-specific audit data, which I don't imagine students would need necessarily unless there's a specific reason and you can share it with them.
Okay. Hopefully everybody's seen that.
It's a website that has been created by the Stroke Foundation with one clear goal.
And hearing it.
Stroke care within Australia by providing health professionals with the tools and resources they need. The website represents a world first for health professionals working in stroke, as it provides tools and resources on over 60 topics covering stroke care, online versions of all Stroke Foundation guidelines, stroke performance and benchmark data from the Acute and Rehabilitation National Stroke Audit, relevant and focused education via e-learning and quality improvement, and the ability to move from evidence to practice by developing plans for improvement based on gaps in practice.
So we're really excited that really the combination of 10 years of activity at the Stroke Foundation within the clinical programs is being brought together with InformMe.
This website is really world leading because of the way that it's got so many different resources housed in the one platform. Often clinicians are quite time poor.
What we need to be able to do is get the right information to the right people and then to be able to deliver it more consistently.
The key in getting data from research proven evidence to implementation is firstly to have guidelines that make clear statements about what is the best practice care, and then to work with clinicians to identify the barriers and enablers to implementing those.
That's where we need things like InformMe to help with getting that information out to everybody, no matter where you are.
And so as new evidence comes to light, we'll be able to update individual recommendations rather than having to wait for a 5-year revision cycle.
We now have a guidelines program that keeps our guidelines up to date so clinicians can see what the latest evidence is.
There are almost 60 stroke care topics in the learning and resources area that gather tools and resources from across the site relating to that topic. So for each topic there may be videos, research, quality improvement plans and related tools and websites for users to view. Excitingly, if you've participated in one of the national audits, you'll be able to see how your hospital performs. Key indicators are benchmarked against the national average and also against hospitals with similar stroke volumes.
The data element is incorporated within the website so people can see how they're actually tracking and performing against what's recommended.
There's still a number of gaps in care, and we do unfortunately know that data alone doesn't necessarily solve problems on the ward.
Collaboration is especially important as it provides a way to share opinions and methods and ultimately reach consensus with other health professionals on improvements.
There's lots of resources around. Other people have been through the same problems. Those resources are available as well on InformMe.
So it's how can they share what they're doing and what they've learnt in their situation and learn from others as well. So it's certainly a two-way process.
It's really helpful when we can start to get information sent to us rather than having to sit down and take the time to go and try and find it ourselves, because it's everywhere and it's really hard to find.
InformMe is designed as a one-stop shop to bring all the information they need in one place, easy to find, easy to navigate, easy to use.
There's no doubt that having all the information in one spot creates much less barrier of entry to making these quality improvement steps and to recognising what the problem areas are.
So use the tool. It's only going to work if we all get involved.
Okay, hopefully everybody heard it there. My apologies, I had the sound on my computer, so you were probably getting your sound at your end plus mine. Fingers crossed that worked. There will be one more video, so let me know if I need to make any changes. I progress through the presentation. I'm more than happy to send that link to people as well if they require it. So really, to summarise there, the key messages of InformMe are visit the site, sign up and really customise the tool to suit your needs, so favourite and bookmark until your heart's content so that you are getting the information that's appropriate to you and that you so desire. Contribute to the content. So upload any tools, resources, suitable websites, and partake in the discussion. Provide us with feedback. We definitely need that to make sure that it's meeting your needs. If there are areas that you absolutely love or there's things that you believe are missing, please do let us know. Look out for the guidelines. The 2017 guidelines will be found here on InformMe, as well as the up-and-coming audit data. And really, please do use the site when it comes to your quality improvement planning. If you have any questions about that in particular as well, don't hesitate to get in touch and we can walk you through that. Guidelines, how soon? Okay, so at the moment they are to be released next year, Patrick, so 2017, about mid next year, is that right, Tony?
Yes, the guidelines are due for release in July 2017. There'll be public consultation in November of this year, so look out for that public consultation so you can go in and look at the draft guidelines, and we'll be looking for a comment particularly from health professionals on the draft guidelines. So we're getting close.
Thank you.
So anyone getting on to InformMe, it's Kelvin again, you can look at the new audit data which will be released on November the 10th for rehab, as well as looking at the guidelines update. Get on, have a look. It's all happening in November.
Okay, Enableme. So now we're sort of switching track and we're looking at the website that is for stroke survivors and carers. Health professionals can definitely sign up too and contribute to the site, but Enableme is really for your stroke patients and carers. It was created specifically for the Australian stroke community. It's a place where stroke survivors can talk to and seek support from other people who have been there. It's a space where people can ask questions that they may have and set their recovery goals. It's also a place where people can offer support, encourage others and share their experiences. Enableme is all about empowering stroke survivors to direct their own recovery. In addition to bringing together information and resources, Enableme is a safe place where survivors, carers and families can connect to share tips, challenges and aspirations. We know that leaving hospital after stroke can be incredibly daunting for stroke survivors and their families if they don't have the right support. Unfortunately, many stroke survivors don't have access to the services, supports and information that they need, and Enableme is really helping them to make that transition home easier. So who is Enableme for? Enableme is focused on the stroke survivor and their recovery needs. The design of Enableme is person-centred, acknowledging and responding to the stroke survivor's needs and abilities. Yes, absolutely, Patrick. That's a really good point. In terms of support groups, you'll now find the stroke support group information on Enableme. A great one to direct stroke survivors to when they're still in your care as well, so getting them to sign up, looking at the closest support group in their area and making that referral is a wonderful way to link them in to those community services. Similar to InformMe, we went through a consultation process with stroke survivors looking at how the site could best meet their needs, and they wanted something that was personalised, empowering, that allowed them to connect with others, that acknowledged that it was a journey and that their stroke recovery would progress over time and that they wanted to track that. They wanted it to be a trusted site where they could engage with others, a site that they could access, and that there was an overarching theme of hope, encouragement, inspiration and reassurance with realism. So Enableme is divided into sections or topics in a similar way that InformMe is. So I'll just run through those now and then I'll again show you a brief summary video. So you'll find that resources are organised by topic, as I said, which allows users to access all the relevant content that they're looking for in one spot. So you'll see things like fact sheets, videos and websites, as well as content created by the Enableme community in the form of forum posts, blogs, questions and goals. So they're all grouped here together by topic. Users can see what's worked for other members of the community and gain inspiration and ideas on how best to manage their recovery. Topics of a particular interest can be followed, and topic-specific updates as well as other important Enableme announcements will appear in their feed. If they've opted to, they'll get a weekly email notification summarising them of what's been happening on the site. In the community section, this is really the heart of Enableme, and here users can share their stories, tips and tricks and support one another to seek help also from health professionals. The health professionals who run Stroke Line, the Stroke Foundation's helpline, respond to specific queries, monitor content and add to conversations where needed. We often get questions about who is writing the content or who is monitoring those conversations, and you can be trust assured that it is the Stroke Line team of experienced health professionals in the area of stroke that are contributing to those discussions. That doesn't mean to say that we don't want to take away from any organic stroke survivor conversation that is going on, because often the conversations and the practical solutions that the community offers are really the most valuable. Health professionals outside of the Stroke Foundation are also encouraged to join the conversation. You can register for Enableme using the same registration info that you use for InformMe. I've jumped ahead. The last thing I wanted to mention about community is this is where you'll find our podcasts. So if you didn't know already, this is something new that we're producing. It's a relatively new initiative, and so far we've produced podcasts on spasticity, fear of a second stroke, neuroplasticity and fatigue. Users can listen into our previous podcasts as well as submit questions for an expert to answer in our upcoming episode. And just previously we had a live chat in the area of fatigue, and that was found here on Enableme, where stroke survivors could chat live with fatigue experts, and we had great feedback about that. The next two sections there, goals and the user profile. So we have a goal setting framework available within Enableme. We're supporting stroke survivors to set SMART goals, either short-term or long-term focus, and help identify obstacles and barriers that may prevent them from achieving those. There's support in terms of goal setting through the stroke line staff, so we can walk somebody through how to create a goal, how to document that, and then how to progress towards achieving it. The user or my profile section, again, quite similar to InformMe. The main added feature that I'll talk about in a minute is really the different disability settings that allow greater accessibility to the site. But in your profile, you can also add things like your age, location. The Ask Me About section is an area of, say, your stroke journey or your recovery journey that you feel you have a lot of knowledge on and that you'd like other users to ask you about. You can also search for other users in your local area or of a similar demographic, and you can create relationships there. Wonderful for those that are living rurally and maybe can't access a stroke support group. So the accessibility features on Enableme allows the site to be customised to the stroke survivor and their varying levels of impairment. So as the slide indicates, viewing preferences can be modified in accordance to left or right hemianopia, other varying degrees of vision impairment, things like cognitive and comprehension deficits as well. So options include displaying the text either left or right or in the centre of the page, enlarging the text, underlining the first and the last word of every sentence, colour coding of content previously accessed versus unseen content, so the survivor can keep track of where they've been in the site. There's an easy English version, and also the text can be read aloud. We're more than happy to help people set up these viewing preferences. They can call into Stroke Line and we can support them over the phone, or if you as health professionals are signing people up while they're with you in your care, it's a really easy process. It walks you through it step by step, and these features can be modified throughout the person's journey with the site. So, I'd now like to present to you Jan's story. So Jan is an Enableme user who took up the opportunity to participate in a memory study at the Monash University School of Psychology Sciences. An advert for the study participants was placed on Enableme asking Melbourne-based stroke survivors with computer access to get in touch. Jan did just that and credits this decision and the memory training that she received to be life-changing. What a fantastic memory program it has turned out to be for me. Negative thoughts that I had had about commencing the program soon turned into positive ones. When I first met the researcher, David, I thought this could be embarrassing for me, especially when I had numerous unsuccessful attempts to remember simple words. I was hopeless with it, and then he asked me to read out a list of words. I could not even remember what those words meant, or even get my tongue around any of them. I thought to myself, I'm going to find this extremely difficult. I must be worse than I thought. David soon put me at ease, and then the new words and skills commenced with Chantal. Strategies, encoding, storage, retrieval, people's names, drawing, homework, so many different things to help improve my memory. Chantal and David had it all. After my stroke, I did not talk or say a sentence for about 3 years, so I just couldn't shut up for either them, as I was so excited, and yes, I was slowly using my new skills. I started to understand what was happening. It was no double Dutch after all. My hippocampus that stores all of our information must have been running on empty. I would like to say the opportunity Monash has given me is marvellous. I am so more confident. I've changed my diet, lifestyle, sleep and exercise. I have learnt so much over the last few weeks, and my memory is so much better. It is making the hard things of life become less so. Simply to remember where I have put something is great. I am honoured to have been given the chance to participate, and I am very grateful. I would highly recommend this to any stroke survivor. It has helped me so much. If I wasn't a part of Enableme, I would have never known about this. So thank you, Enableme. So that's a really good example of an Enableme user who has come across a study that we had up on the site, and she's made that step of making contact and enrolling in the research and has found some amazing benefits. We've got lots of stories and examples of how the site has improved the lives of Enableme users, and I'm just going to share a few more with you before I play our final video. So the first one here, we have Mary, who is sharing her gratitude for the support showed by the stroke survivor community. I'm about 18 months down the track from having a stroke. After all this time, my right leg still feels like it weighs a ton. My speech is unreliable and still fighting fatigue. I've come to realise from reading your posts that I'm not on my own, and I shouldn't be so hard on myself, so thank you for sharing. The next one, we have Jude on accessing a neuropsychologist. Thank you for your help, Heather, and for the links, Simone. Very helpful. Doesn't seem so daunting now. And then we have Jo on supporting her father in the initial days of his recovery. Thank you so much for taking the time to reply, ladies. I really appreciate your help. I'll certainly give the line a call if I need more help. It's comforting knowing you're here. And just a few more examples. Thank you for sharing. Thought I was only feeling sorry for myself, and it was only in my mind. So very true, knowing your limits and having a day or two chilling alone. That was in regards to managing fatigue. I think viewing the video has boosted his confidence some more. And finally, here's just a really good example of some practical tips that stroke survivors can share with one another. So here's Jenny offering Vicky's husband some suggestions on showering. So Jenny said, I use a hairdryer on low to dry my feet. Soap on a rope attached to a shower rail is great. Saves me dropping the soap because I'm unable to pick it up. The nurses in rehab made that for me. For women, I wear a bra that does up down the front, very comfortable, and I find a shower stool and bathroom chair necessary. There's some really great conversations like that happening on Enableme every day, and we really do encourage you to direct your patients to the site, either encouraging them to sign up or sending them through to Stroke Line so that we can support them to do that. I'm now going to show the Enableme video, and then we'll come back and wrap up and I can answer any questions. So fingers crossed the audio works.
Welcome to Enableme. Enableme is a place to talk to and seek support from other people who have been there. It is a place to find resources and information, ask questions, and find the answers that you need. You will also be able to set and work towards recovery goals. It is a place where you can offer support, encourage others, and share your experiences, because you are not alone. You are part of a bigger community of people who stand side by side facing life after stroke.
Enableme came about through conversations with stroke survivors. We have many stroke survivors who contact us and talk to us about a void in the community when they go home after stroke. They finish rehabilitation, they finish technically what is considered to be their recovery, and they get home and discover that that's not the end of their journey, it's the beginning. And they asked us to create something that would allow them to direct their own recovery. And the exciting thing about Enableme is survivors have been part of its development from that very early stage, when we first thought about the idea, to thinking about how it needed to work, the problems it needed to address, the content it needed to have on it. This tool's been developed by stroke survivors for stroke survivors.
You know, I'm pretty excited about Enableme because I think it's the first time that we've brought together information, tools and connection with peers all in the one place. So all of those things are very complementary, and it's going to be really good to see all of those things as in a one-stop shop.
Enableme will provide that connection that is so important to prevent people getting isolated.
I think for stroke survivors it's very important to know that there are other people out there and to share stories, to share tips on how they've recovered, and to share information as well.
For me, finding activities and stuff post-stroke is very hard. For me to find, even now, like finding friends and finding people that actually have an understanding.
The website's a great tool, not just for stroke survivors, but for carers. And you can learn so much more about the type of stroke, rehab, who can you speak to. We've got phone lines now. There's the full website. There's so much information on there, which I think my wife would probably say, I wish she had all the information back then, because it would have made her understanding better of strokes, because she didn't know about strokes.
We've also pulled information from other medical sources to provide some clinical information for people to help guide their recovery, and to also understand the language that medical professionals speak in hospital and also throughout their rehabilitation phase.
For those that have visual field loss on the left or right hemisphere, you are able to configure the way content appears on the site by selecting left, right, or return it to centre. You can increase the size of text to improve readability. You can also have text underlined at the beginning and end of lines to improve reading comprehension. A high contrast version of the site can also be set. There are also visual cues to help remind you of content you have previously visited. Items with an orange slice have not been visited, whereas indigo items have. A highlight for links option can also be set to show which items on the site are clickable. Enableme also provides the ability for content to be read to you.
If they have an interest in a particular topic, they can choose to follow that topic so information is pushed to them as it emerges. You will be able to harness the information, the experiences, the expertise of a huge community of stroke survivors and carers, health professionals and experts, research and publications to help you direct your recovery to be able to get back to that life that you want after your stroke.
Apologies, I know some of you struggled with the sound there. Again, I can definitely make these slides available with those links in as well. Otherwise, yeah, head to YouTube. Those videos currently are public, however, normally they're just located on either Enableme or InformMe on the main homepage. So the summary messages for Enableme, I think I've really mentioned these already, but try and introduce Enableme as part of your stroke education. You'll find Enableme referenced throughout my stroke journey, so flag it there. Enableme empowers recovery, particularly when out of the hospital environment. Enableme is user-friendly. You would have seen a lot of those features, and it provides stroke survivors with the opportunity to connect with other stroke survivors, other carers, as well as access information, resources, advice, support, and goal setting. We've got a question from Tony. Does Enableme have posters or advertising we can order? Absolutely, Tony. I can definitely send some Enableme brochures out to you. We've got a great poster flyer that combines both Enableme and InformMe, and that's a good one for health professionals. Otherwise, we've got just an Enableme brochure that you can give out to your stroke patients. So do get in touch, and I can get some of those in the mail. That's my email address there. Any other questions or comments about those that have visited the sites, either InformMe or Enableme?
Alana, Patrick here. I might pop a question in before anyone else puts one up on the chat. Are you finding that most people are accessing Enableme after they're receiving information while they're in hospital as part of, say, My Stroke Journey or other methods?
Yes, I would say that was the case, Patrick. People are signing up in that subacute rehab phase. We're seeing, a lot of those queries that people have are going directly to Strokeline when they're still in hospital. So sort of Strokeline and My Stroke Journey when they're still in care, and when they discharge, then they're moving across to Enableme. But there's no reason why people can't be on Enableme day one of their recovery. It's just about what works best for each stroke survivor.
So I guess you'd say there's even, the possibility or the potential for someone experiencing their inpatient rehab, for example, to be involved in Enableme at that point.
Yes, without a doubt. And I've touched base with a few sites here in Victoria where they're looking at integrating that Enableme sign up as part of the rehab journey, so that the stroke survivor can move towards managing their own recovery early on in the journey as such.
It'd be interesting to perhaps hear some information from people at those sites as to how they're finding that as well.
Absolutely.
Right, folks, look, if there's more questions, please type them into the chat facility. We'll give you a minute or so. And for those of you still online, please send me those attendance sheets in whatever shape or form you can at some point, so I can get a gauge as to how many people have been involved in the webinar. It's useful for ASNEN to have this data, and it supports ongoing webinars. And in the meantime, thanks Alana, and thanks Calvin, and was it Tony also back there? Thanks very much for presenting today's webinar. It was very, very useful, and I think we could all perhaps get more people interested in Enableme, and certainly utilise InformMe. All those resources are begging to be used and to be added to, of course, via the collaboration. And also don't forget that this webinar is recorded and will be available on InformMe as well as the ASNEN website. There's a couple of questions there now, I believe.
Tara, that is a really good point. We are finding, though, that The older stroke survivors surprisingly are gravitating towards the site. We have quite a few users that are in the 70 plus age group. We do appreciate that it's not for everybody, and we do have those alternative platforms such as Strokeline, stroke support groups that we can be helping refer people through, but definitely don't let age be a barrier. Thanks everybody. I also just wanted to mention that we will be in Canberra in a week or two with a stand, so pop by and say hi. We'll have some iPads. We can sign you up on the spot. So we'll see you there, and we'll have some pamphlets and things. So I'm assuming most.
Thanks very much.
Thanks, Patrick.
And also don't forget to check out the ASNEN workshop if you want to catch up with the ASNEN content of the conference in Canberra.